This is Dr. Chukura with the Foot and Ankle Clinic of Albuquerque. This is just going over specific instructions that you have to follow after having a nail procedure. And these are the things you'll need. Gauze, antibiotic ointment of your choice. Here we have bacitracin. You need Coban or horse wrap dressing. 1 inch should be fine. Essentially what you want to do is after the area has been washed thoroughly with soap and water and rinse, you want to avoid soaking or using peroxide. Those can increase the risk of infection. You want to make sure you get the gauze and then you put a piece of gauze over the wound, but make sure you have a liberal amount of the antibiotic ointment over the gauze. And that part of the gauze will be what goes in contact with the procedure site. Here we have Coban, and this 1 inch Coban will then securely hold the rest of the dressing to the toe. And be careful not to put the dressing too tight, because it can act as a strangulator and decrease blood flow and cause other issues. And again, you want to be careful that you don't soak the toe in Epsom salt or water. That can cause other issues, increase the risk of infection. But really, washing this area with soap and water, rinsing it, and then putting the antibiotic ointment with the gauze and securing with the 1 inch Coban should be just fine. Here we're looking at the gauze dressing has been placed, again with a liberal amount of antibiotic ointment, and now we're securing the rest of the dressing with the Coban. Monitor for clinical signs of infection. Change your dressings daily after washing with soap and water. Monitor for signs of infection like redness, swelling, pus, pain, any drainage, any swelling whatsoever. In fact, anything that is concerning after the procedure, please feel free to call our office and we can go over those. And in a nutshell, this is what you do. Make sure that the dressing is securely placed without being tight. Again, Dr. Chukura for the Ankle Clinic of Albuquerque.